Aloha! This CME activity is jointly provided by the Queens Medical Center and UH-JABSOM Department of Geriatric Medicine. We offer free continuing education for this series. In order to receive a CME or CEU, participants must complete the online evaluation at the end of the webinar. Your comments are very important to the planning committee and will be used to plan future programs. Health professionals, you can now check on your CME credits online. Go to www.queens.org and type CME in the search tool. Click on My CME Transcript, then sign in to generate your transcript. We want to remind everyone that this is an ECHO webinar, which means that this session serves as a forum for mutual teaching and learning from our experts and from each of us on the front lines. As the ECHO motto goes, all teach, all learn. So it will take all of you to create this community of learning. In the spirit of aloha, we encourage you to turn on your cameras to help us build a community of learning. Feel free to eat during the ECHO session. Good nutrition is the key to a healthy lifestyle. A little bit about our format. After a short lecture from our experts, we will share expertise from the rest of the team and then open up the time for case discussions. We invite you to share any geriatric cases. It may even be on a topic not related to the topic of today's lecture. We only ask that you keep it a HIPAA-compliant case for discussion. That means please do not share the patient's name, birthday, address, and so on. We all learn best from our patients. They are the best teachers. Our interdisciplinary team is here as well, and we are all willing to teach and share our collective wisdom with you. Most of you already know me. I am Juanette Gaylord of Alliance of Residential Care Administrators, ARCA. We have Mary Botan, President of Foster Family Homes Association. Elsa Talavera, President and CEO of All Island Case Management Corporation. May Magnayan, nurse with Lokahi Case Management. Gabriel Vegalara, inpatient coordinator at Aloha Care. Leila Ventar, health coordination manager from United Healthcare, Kauai County. And Dr. Rita Bell Fernandez from University of Hawaii. We are in the first month of our series on what matters. If you're interested in viewing any of those lectures and handouts, you can find them on our website. Unfortunately, we cannot offer certificates of attendance for videos you have viewed. You must participate in our education live. The title of today's webinar is Hawaii SHIP, Helping Hawaii's Medicare Beneficiaries. Today, we are pleased to welcome our speakers from Hawaii SHIP, the State Health Insurance Assistance Program. Hawaii SHIP is a federally funded volunteer-based program administered by the Hawaii Department of Health's Executive Office on Aging. The program provides free, unbiased Medicare counseling and education to beneficiaries and caregivers statewide, helping individuals navigate plan options, coverage questions, and cost-saving resources. Joining us today are James Marchant and Stephen Lung, who work closely with the community, Medicare beneficiaries, and community partners throughout Hawaii. We are grateful for their time and expertise and for the important work they do to support our community. Please join me in welcoming our speakers from Hawaii SHIP. We're delighted to have them with us today. Aloha.
Hello, thank you.
Aloha.
All right, I'll be starting off this presentation. So thank you for having us. Thank you. We are Hawaii SHIP, and we're just going to be quickly sharing about some of the benefits and some of the updates for Medicare that have been happening. So Hawaii SHIP is a part of the EO Executive Office on Aging, the Hawaii Department of Health, which is committed to maintaining an environment free of discrimination, retaliation, or harassment on the bias of race, color, origin, age, disability, or any other class that's protected under the federal or state law with respects to any program or activities. Please see the link for more information. So what is Hawaii SHIP? Hawaii SHIP is a federally funded volunteer-based program that's from the Administration from Community Living. We're only one of 54 federal programs nationwide. So in every state, they will have their own Hawaii ship, sometimes even every county. And we provide Medicare information as well as Medicare assistance in many different ways. We are administered by the Department of Health. If our name doesn't seem familiar to you, you might have known us as Sage Plus back in 1992. And one thing that's important that we like to make sure everyone know is that we are not affiliated with any insurance company, which is why we are able to provide non-biased information. So some of the free services that we provide are the reliable and unbiased one-on-one counseling sessions with counselors like from every part of Hawaii. We can do this either over the phone, email, Zoom, sometimes even in person. We offer educational presentations for groups of 5 or more, so it's kind of like this one. Those thank you all for coming, as well as provide general information and assistance provided at senior fairs and many other community events statewide. So why do we do this? And that's because Medicare can be confusing. There's a lot of moving parts, a lot of things are changing yearly, and it can cost you a lot if you miss any of the important deadlines. So some of the ways we help out is creating nice visuals to help people understand. We've used this visual a lot to help people really understand that there is a difference between original Medicare as well as Medicare Part C or Medicare Advantage plans, specifically what they can and cannot get. Another big way we help the community is something called plan comparisons based on your area. And we can help find in the beneficiaries either a Part C, Part D, or a Medigap plan, or all three, which is our most common. And we provide them with their top 3 best plans based on their zip code and any of the medications they take. We help them find the pharmacies that are closest to them to pick up their medication. And we just help them find like the most cost effective, what are they looking for? And should they need it, we also go further into this with counseling. Another way we help the community is through our certified volunteer specialists who are all, or sorry, another way we help Hawaii's community is through just being all specialists in screening for these 3 programs, Medicare, Medicaid, and Extra Help. Every counselor can do this, and what we do is that we help screen if they're eligible to apply for any of these programs. And if they do apply for these programs, we can help them apply to it, or we can help them even apply for these programs should they need it. As I've mentioned before, we have group presentations, and these are just a few of our most requested topics, going from Medicare basics, Medicaid, and versus Medicare, sometimes focusing onto either one of the parts or even just general tips for talking with your doctors. Another thing we do is fair and exhibits. This is just a great way for us to distribute information to the community, as well as just answer any questions people may have when they pass by. But our most popular and perhaps one of our most used features is our counseling. And this is a free, unbiased guidance with personal Medicare counseling. And we find ways to see if we can help you reduce your premiums or your medication costs, answer any questions, any confusions that may have happened. We offer guidance. And if we, for whatever reason, can't help you, we make sure we can find the people who can, and we help guide you to them. And here are just a few of our testimonials. Finally, we also have the Hawaii Ship website. This is a great place to get more resources, multi-language resources, see some of the frequently asked questions, or even get up-to-date information on Medicare on our blog. And this is also a great place for if you or a patient ever needs our information. So yeah, always feel free to hand your patients over to us or call us yourselves. We are always more than willing to help. And here are just a picture of some of our staff. And now I'm going to pass it on to Stephen, who's going to give you some updates of what's been happening in Medicare.
Aloha, everyone. My name is Stephen Lung, and I have been a volunteer with SHIP now for over 7 years and have really enjoyed it. And what I'm going to share with you in the next few slides is just some information about what's happening with regard to Medicare in 2026. I don't think you'll find that there are any major changes. We have done presentations for you previously, the Medicare Basics presentation. We're not going to try to, and other presentations, and we're not going to duplicate that. But we'll just run through these slides, and then we'll be happy to answer any questions that you may have. So next slide, please. The information about the Medicare benefits can be found in the 2026 Medicare New Handbook. This handbook is distributed every year in September to all Medicare beneficiaries, and it contains a wealth of information about the various services covered by Medicare. If for some reason you have a patient, or if you need a copy of the handbook, you don't have it, feel free to contact our office at the number that's indicated on the screen. We do have a limited number of these handbooks, but we'll do our best to try and accommodate these requests. I don't think we've run out of the handbooks yet, as far as I know. Next slide. So here's a few pages in that handbook that may be of interest to you. On page 33, it talks about behavioral health integration services. For this particular audience, you probably well understand already that Medicare does cover treatment of behavioral health needs and conditions like depression or anxiety. There's also something called a model called psychiatric collaborative care. I don't know if anyone is within the state is actually providing services through that model. There's more information in the handbook about what it consists of. And if the services are being provided, there is an agreement that's required that has to be signed with the beneficiary. But also keep in mind that for behavioral health services, that the Part B deductible and coinsurance apply. So there are out-of-pocket costs for the beneficiaries. On page 38, it talks a little bit about depression screening, and this is a service that is covered once a year if it's done in a primary care setting, and it's covered in full and no cost to the beneficiary if the primary care physician is participating with Medicare and accepts a Medicare assignment. And finally, on page 54, there is the information about the annual, the Welcome to Medicare preventive visit. That is something that is covered in full under Part B during the beneficiary's first 12 months. And it consists of a health history review, again, preventive care education, so forth. It also assesses substance abuse risks. And there is also a yearly wellness visit that is a benefit under Medicare. So any additional services, they go above and beyond this preventive visit or wellness visit. There could be coinsurance or deductible costs involved. Next slide. So this slide shows the changes that are taking place in the Medicare premiums in 2026. Again, for Part A, the hospital insurance, that continues to be free, no premium for those who have contributed to Medicare and Social Security for at least 40 working quarters. And you can see that for those who fall below that threshold, 30 to 39 working quarters, the monthly premium that was $285 last year has now gone up to $311, an increase of $26. And if you're below 30 working quarters, then the monthly premium that was $518 has gone up by $47, and now it's $565. And there's also been an increase in the annual deductible from $1,676 to $1,736. These kinds of increases are routinely happen every year. The amount of the premiums and the deductible increase. Fortunately, the great majority of persons, Medicare beneficiaries, qualify for free Part A because they have at least 40 working quarters themselves, or their spouse does. And then on the outpatient Part B side, the monthly premium is going up from $185 to $202.90. That's a fairly significant increase in the premium cost, and the annual deductible increases from $257 to $283. So healthcare just keeps getting more and more costly. We see that in Medicare as well as a lot of other programs too. Next slide. Last year in 2025, Medicare beneficiaries have the option of spreading out their medication costs over the course of a 12-month period instead of paying everything, paying their coinsurance amounts up front. And if someone is under this prescription payment plan, or was under the plan last year, then they continue in the plan in 2026 unless they actually opt out. So it just automatically continues. And those who are under the program will receive a notice explaining the terms and conditions. And if there's a minor change in terms of the amount of time to process a request to opt out. Okay, it's now 3 days instead of 24 hours previously. Next slide. As a part of the Inflation Reduction Act that was passed a number of years ago, the federal government started to negotiate prices of these well-known brand name prescription drugs. You can see the names of the drugs on the left. Many of them are very well known. We see them advertised a lot, and you can see what the price was in the third column. You can see what the price was in 2023 before the negotiated prices went into effect, and you can see what the prices are this year. And of course, these prices are these are the total costs of the medications. These are not the patient or the beneficiary's out-of-pocket costs. But the government has negotiated some pretty hefty discounts for many of these medications, well in excess of 50% for many of them. So beneficiaries are definitely, benefiting from that, and access to these medications has improved as a result.
Hey, Stephen, it's Gabe with Aloha Care. I'm just helping guide this chat, and I have a quick question here. So what I'm not sure if you know or not, what drives the discount per each drug? Is it location based? Is it supply and demand?
I really don't know how how the federal government figures it out with the prescription drug manufacturers. I'm not familiar with that process. I don't think it is. I'm pretty sure that there isn't a specific formula that's used, but I honestly don't know how they do it.
Okay, no worries. And I'm guessing that's something very common when they use SHIP, for like the costs and everything to make sure it's accurate.
I'm sorry, what was the question again?
When using the resources for SHIP, when it comes
Mhm.
to the kind of cost, I'm guessing they use this sort of like to understand what the discounts are so then they can try to get the math right for when
Yeah,
members are no, okay.
yeah. It the very often the beneficiaries will come to us and ask us for assistance in figuring out what their out-of-pocket cost is going to be for various medications that they're taking. And so, and we have a tool that we use, an online tool with Medicare.gov. And so
Okay.
we can kind of compare what the tool calculates against these costs. But yeah, it should be totally consistent with these negotiated prices. Yes.
Okay. Thank you so much.
All right. Next slide. Also, this has been around for a few years, but um, the federal government has been, concerned about the out-of-pocket costs for insulin, and beginning in 2023, started to cap those costs at $35 per month. Initially, it started with the certain types of insulin. It wasn't across the board for all um, the the various insulin manufacturers, but now in 2026, that cap goes into effect across the board. So it doesn't matter what kind of insulin is prescribed for you by your physician. The out-of-pocket cost for the beneficiary is limited to $35 a month, and it's not subject to a deductible too. So again, the whole idea is to make these costs for insulin as affordable and predictable for the beneficiaries as possible. And of course, to better manage the condition that the insulin is being prescribed for, diabetes. All right, next slide. Also, the same principle applies to vaccines, and beginning this year, all of the vaccines covered under Part D will be free. There will be no out-of-pocket costs. These are the vaccines that are recommended by ACIP, the Advisory Committee on Immunization Practices. So it is subject to change. It's a dynamic. Hello? Yes? Yes? Okay. Next slide, please.
Where's the slide now? I can't see the slide.
This is an interesting one, prior authorizations. One of the distinctions between original Medicare and the Medicare Advantage plans that most Medicare beneficiaries are covered under now has been that the Medicare Advantage plans do have prior authorization requirements for certain services. Don't know if if any plan is applying prior authorizations for behavioral health services, but original Medicare has not had prior authorization requirements. But as this slide indicates, certain states on the mainland, not here, are going to begin to use a system to do prior authorizations under original Medicare. It says that AI will be used to review review these authorizations more quickly. It does say that AI won't make the final decision, and that a human clinician will still review and approve. My guess is that if AI approves it, it'll just go through. And if there is a denial, then the denial gets reviewed by a clinician, before it's actually finalized. But again, this is in the very early stages in those states, and it remains to be seen whether it will become, whether it'll be implemented in all states under original Medicare or not. I think most of you are probably aware that there's a fair amount of controversy over prior authorizations. So again, we'll just have to wait and see what happens. Next slide. And this slide just shows you different websites where you can get more information about Medicare. I alluded to Medicare.gov, which is an excellent source of information about a lot of things related to Medicare. But as volunteers, we use it a lot in our counseling with beneficiaries to help them answer questions, to help them with understanding their coverage options for Medicare Advantage, for the Part D standalone prescription drug plans, and the Medigap plans. It's a great resource. Also, really, really helpful to beneficiaries in understanding what their out-of-pocket costs are going to be for medications, and to see how those costs vary depending on the Medicare Advantage plan or the standalone prescription drug plan that they may be covered under. And then Medicare Interactive, if you ever have a question about Medicare policy or processes or procedures, this is an excellent place to go to get information. And then at the bottom, the Social Security information. Social Security administers the enrollment to Part A and Part B and collects the premiums, but the actual administration of the Medicare program falls to CMS. All right, next slide. I think we're pretty much done here with the slides. Oh, I'm sorry. So these are examples of questions that beneficiaries may have that we can assist them with. We deal with lots of different kinds of questions. A really common scenario is people who are approaching the age of 65, they're becoming eligible for Medicare, and yet they need to understand what their coverage options are, and so we can help them with that. We try to be neutral and just present information and help them to make a decision that works best for themselves. There may be questions about specific benefits under the different plans. There are questions about enrollment. There's a number of different enrollment periods for Medicare beneficiaries, depending on what it is you're trying to enroll for. So Medicare is not the easiest program to navigate, and so that's what we're there for, is just to try and assist them and walk them through it, guide them so that they can make the best possible decisions to meet their needs. Next slide. And again, there's our contact information for SHIP. Feel free to refer your patients or associates if they have questions about Medicare. We can be contacted by phone at the helpline or through the website. And that's pretty much our presentation for today. I would like to open the floor for questions. We'd be happy to answer whatever questions we have. And I'll also ask a question of my own. I think I'd be very curious to know, since this is behavioral health, what kinds of behavioral health issues that you see most commonly for the kupuna, the Medicare beneficiaries that you provide services to. Okay, so.
All right.
Open.
Thank you so much for your presentation there, Stephen, all the information here. We do have a quick question. I know you just asked a question here, Stephen. You're talking about over-the-counter medications, if they're not covered by insurance, such as aspirin.
So the question is, what would the question be?
Why is it that some of the over-counter medications are not covered by insurance, such as aspirin, those sort of medications?
Yeah. I think that that's a pretty common practice in the insurance industry. It's probably, mainly just to, limit um, the cost outlay by the
Hmm.
plans, and so I think the feeling has been, and I think that this has just become kind of an established, practice when it comes to health plan benefits that over-the-counter medications are just fall outside of the what's defined as covered by the plan, and that the covered individual or beneficiary should be able to assume, responsibility
Hmm.
for paying for those over-the-counter medications. There are certain plans that do provide a certain amount of coverage, though, for over-the-counter medications.
Hmm.
Um, there are special Medicare Advantage plans for the beneficiaries that qualify for both Medicare and Medicaid or Quest. So if you have dual coverage, if you're covered under those dual special needs plans, then those plans will typically provide an allowance for over-the-counter medications that the beneficiary can use. But to my knowledge, those are the only Medicare plans that cover those services.
Okay. Thank you so much. And did you say you did it? You've been volunteering for 7 years now?
Yes. Mm-hmm.
So what have you seen the most in growth with Hawaii Ship so far?
I think um, that's a good question. I think that we what we're what we've been seeing over time during the 7 years that I've been working as a volunteer has been that I think increasingly when I started, a majority of the beneficiaries were still covered under original Medicare, but
Okay.
every year since I started, the the percentage of beneficiaries that are just aging into Medicare, the majority of them are signing up for a Medicare Advantage plan. And so uh, it means that for a volunteer like myself, we need to be better informed about the Medicare Advantage plans and be able to counsel beneficiaries about how those plans work, what kind of benefits they have, the pros and cons of the plans. So um, I think that makes it a little bit more challenging for us as volunteers. But I also think it's great that the beneficiaries have more choices,
Hmm.
and having more choices can be a good thing or a bad thing. It can be a good thing in terms of you're having more options and flexibility to find something that will better meet your needs. But it can be a bad thing because it can be confusing. It's just more information to process or to
Yeah.
try and go through it
A
to
lot
make
of moving
a
pieces
decision.
after 7 years. Yeah, it's a long time.
Yeah. But now, again, as I said earlier, majority of the Medicare beneficiaries are under the Advantage plans, and the that percentage just keeps increasing a little bit every year.
Okay. Hmm. And what was the question that you asked earlier? Sorry, Stephen. I know you were talking about since majority, I think, are behavioral health.
Yeah, I'm just curious to know, are there, what kinds of uh, I guess, behavioral health services, um, do kupuna and seniors need that you see a lot of? Um, I'm just, wondering, how is it different from the general population? And is there any way, I'm just wondering if we understand that, maybe there's some way that as volunteers, as we counsel people, that we might be able to do that more effectively. So,
Hmm. Okay. So just more so trying to see what experiences they've had, to see where you guys could help better.
right,
Hmm.
right.
Okay.
Mhm.
Okay. And
You
to the
folks,
audience here, I'm going to go ahead and put this question in the chat. And then if anyone that's worked with Hawaii Ship, if you could also drop an emoji that best describes your experience with Ship so far. But I haven't worked with elderly myself as much, so I can't speak from it too much. But just from what I've seen, are you speaking if they get some sort of behavioral health condition and then to see which could be, I guess, more in depth? Is that what um
I guess I'm just curious to know what kinds of special challenges, um, you see as um, clinicians in taking care of these patients, um, trying to take care of the behavioral health needs that they have. I think for us as volunteers, it's helpful for us to know more about the population that we're trying to serve too.
Mhm. I'm not a clinician. I go in and out of the hospital over at Queens
Hmm.
on Oahu, Punch Bowl. Just from what I've seen, typically it's been from the elderly population, a lot of Alzheimer's,
Yes.
a lot. And I've also been in contact with some other health coordinators as well that do work in long-term support services and the more respite scene. And they also have told me that it's typically Alzheimer's. That's the more behavior when it comes to the general population.
All
can
right.
I interject?
Go
Can I
ahead. Go
also
ahead.
interject?
Yes. Yes.
So a lot of it has to do also with depression.
Hmm.
If you want to be a little bit more specific, if you can consider that behavioral health.
Yes. Hmm. And I guess I'm just wondering, is there a big problem with, um, you know, being underdiagnosed and undertreated in the senior population?
Hmm.
Well,
I
we've
can.
spoken numerous times on depression on this through this echo.
Hmm.
So it has been targeted with our leadership with Dr. Fernandez, Dr. Wen.
Hmm.
Definitely talked about depression quite a few times and how
Mhm.
to treat it, trying different methods, not only pharmacological, but yeah. So we have discussed it numerous times.
Uh, sure. Yeah, I'm sorry. I guess I'm just wondering from a benefit standpoint, are there any, barriers or things getting in your way as far as what Medicare covers or doesn't cover that makes it more difficult to treat these patients?
Hmm. I guess for my experiences, sometimes you get elderly members that get admitted and they don't have any family connections, so that it's a bit of a timely process. So it just makes them stay a lot longer at the hospital, and I'm sure costs are a lot higher for these members. So that's typically, at least for me, what I've seen so far when it comes to specific barriers.
Hmm. I
But
see.
I will add, when it comes to barriers with ship, has there been any like time or process or communication or even I guess clarity on what Hawaii ship is? This is first time for myself to from hearing on this. So
Yeah, I think well, it's hard to know how um, the level of awareness of SHIP and what SHIP does. It's hard for us to measure that or gauge that. I mean, we definitely are out there trying to increase the awareness both of the Medicare beneficiaries directly, but also the people like yourselves who may be taking care of them and assisting them. So I think we need to uh, approach that from both angles. But it's hard for me to say how how well recognized or again what the level of awareness is.
okay.
We're certainly trying to make as many people help as many people to know about us and what we can do.
Mm-hmm.
Yeah, this is Dr. Nguyen. I was kind of wondering about the role of more telemedicine for behavioral health for our care homes.
Mhm.
How is that covered, or is that something we should know more about, or increase the capacity for?
Yeah, that's a good question. I know that during the pandemic, there was a big, I mean, Medicare relaxed their guidelines a lot, or the restrictions on coverage of telehealth services. And then as the emergency period came to an end, they reinstituted the older policies. But as I understand it, there is an exception for behavioral health. So I'm hoping that behavioral health, telehealth, an exception for behavioral health services to be delivered through telehealth. So it's my understanding that original Medicare will still allow telehealth for behavioral health services. It's also my understanding that the Medicare Advantage plans have maintained pretty liberal policies with regard to use of telehealth for behavioral health services.
But is the federal government going to reimburse the doctors that are using the telehealth system?
Yes, it's my understanding that they will. We can double check on that and confirm that, but yes, it is my understanding.
Thank you.
Yeah, somehow I think it needs to be utilized, the more awareness and utilized a lot more, because it is difficult for getting elders with behavioral health issues out of the house to doctor's appointments, and it's just overwhelming, and it really, maybe it's something we should increase awareness of.
Right. That's an important way of improving access to behavioral health services. So again, we can check into that and just get back to you with an answer in terms of an official confirmed answer as to what the coverage is for telehealth. But it is my understanding that behavioral health has an exception that allows telehealth to be covered.
And Stephen, I have a quick question. So there have been times where at Aloha Care, we're at events and we've had members come up to us to help them apply for Medicaid or anything like that, but that's not something we typically do. So we have to coordinate them and guide them in the right direction. But what's been misunderstood with Hawaii Ship? Are there any aspects from it, from your 7 years, that sometimes they can misunderstand how Hawaii Ship helps?
Well, first of all, it's people often have a hard time distinguishing or get confused about the distinction between Medicaid and Medicare. So we will often have be approached by beneficiaries who have issues related to Medicaid, and what we can do to help them is very limited. We do have some capability to assist persons with applying for Medicaid, but I would freely acknowledge that we are not the experts in that area. And I think that the best resources for that are organizations like Catholic Charities or the federally qualified health centers, the FQHCs. Their staff handle this kind of thing all the time on a daily basis. The other thing that is a little bit frustrating for us is that whenever someone asks us a question about Medicaid eligibility, it's hard for us to answer that. I mean, we know what the income and asset uh, eligibility thresholds are. But if somebody wants to know what's going on with their particular application for Medicaid, we can't tell them. We don't have access to that information, and we have to refer them to MedQuest, the Department of Human Services. So it would be nice if somehow there was access to that information too, because there's a lot of people that have both Medicare and Medicaid, and a lot of times knowing what someone's Medicaid status is important in order for us to give them good advice about Medicare.
Perfect. And I saw earlier for the Medicare 2026 updates, that information in the pamphlet that you had, that gets mailed out, you said, Stephen?
The handbook?
Yes,
Yes,
the handbook.
The Medicare U handbook, yes.
Okay. Are there any online resources that could get the handbook in a PDF format or anything like that?
Yes.
Yeah, I was going to turn to James for an answer on that one.
Okay.
I believe it's offered on SSA.gov,
SSA.gov. Okay, perfect.
but we could also hand it to you.
Perfect. Okay. Yeah. Sometimes our members don't have any mailing addresses. So I was just asking because sometimes we do have to print out and give it to them ourselves. So, and I did hear that we had some care homes online. So I do have a quick question. If everyone wants to just drop it in the chat, just what's one thing that helps make being at a care home frustrating, overwhelming? And then what's something positive? How do care homes feel supported as well? And then just drop an emoji if you'd like. You don't have to give me a long answer at all. And then for Hawaii SHIP, what's been growing in a positive direction the most with Hawaii SHIP? If I can ask James or Stephen.
You want to try and take that one, James?
I do think one thing that's been going well has been that Inflation Reduction Act. They've been able to cut the cost of a lot of those drugs by most of them by more than 50%. Some are still a bit expensive, but we know that they're not stopping, and that next year there's going to be 15 more, and then in 2028 there'll be 20 more. And the hope is that they can keep reducing these drugs so it doesn't become overwhelming or impossible to get this proper medication for our community.
Okay. And are there any times where there can be Medicare updates that happen, and then I guess they can happen so often, right? It can be abrupt. How do you guys organize all of that? So then there isn't any confusion with, I guess, the general population that you work with.
We generally, I'll just say that we generally don't see a lot of policy or benefit changes mid-year for Medicare. They tend to be confined to happening on a calendar year basis. At least that's been my experience so far. It's a little different from private insurance, where those kinds of policy changes or process changes can happen more frequently. So yeah, I think that's one good thing about Medicare, and that is, I think they're pretty careful of not to be constantly throwing changes at you during the course of the year.
Another thing, like Steven said, a lot of times changes will happen on a certain time of the year. Eventually we're going to get new numbers. And when we get those new numbers, as a SHIP staff member, we make sure all our volunteers know about that so they can provide the information to any of the beneficiaries they're working with. We also make sure to upload onto our website. And then occasionally we just try to get the word out there as best as we can. It is hard to reach everyone, but we do what we can, especially with the volunteers helping us all across the islands. That's kind of like the best way we can really reach out, but most of the time people don't really notice these changes in the numbers until like they like need it.
Yeah,
So like I don't think like a lot of people aren't aware of the changes to like I think the numbers we're still waiting on right now even are like how are the income levels going to change for what qualifies for the application of Medicaid, MSPs, and a lot of the extra help,
I
which
see.
is a really big thing. But most of the time it's just people don't even know what the numbers are right now. So it's not
Hmm.
like we need to get the word out there. We try our best, but a lot of the times people don't really care about the numbers. They just want to know, do I qualify? Yes or no?
Like at and more like on needed as needed basis.
Sometimes, yeah. I
Okay.
think the most popular number that we tried to get out as soon as we get it would be the updated premiums. So the part A, part C, and part B. Part B, C. Mainly part B though, because that's the one everyone has to pay.
Mhm.
Perfect. And just for some of us that work the ground and see these members daily, what's something that would help Hawaii ship? Hi guys, just a heads up, please mute your mics. If you have a question, go ahead and sorry about that.
Sorry, you were asking a question though, in the middle of a question.
Yeah, sorry. So I was just keep getting muted. Sorry about that. So I was just asking what would help Hawaii ship the most when we encounter our members and then explain what Hawaii ship is. Because a lot of my members that I've encountered could definitely use Hawaii ship, but just wanted to hear it from your perspective so we can work better as a team as well.
Personally, I think the most important thing for most beneficiaries to hear is that we are a free service. We do not cost anything at all. We are funded by the federal government, as I've shown. And like, so like the main thing is like a lot of people I know, like they're afraid to contact us because like, oh, do I have to pay a fine? Like, how much is this going to cost? They don't realize that everything we do here is free and it's for their benefit, unbiased opinions and such.
It's really easy to access our services. You don't have to fill out a form or anything like that. It's as simple as calling our helpline and leaving a message, and it can be as simple as my name is such and such, my number is such and such, I need help, and someone will be
Mm,
assigned to reach out to them, um, or they can send us an email. But we don't. We try to make it as easy as possible for beneficiaries or people that are signing up for Medicare to request help from us.
yeah, and it could be a very overwhelming for especially the elderly population as well,
Mhm.
with the constant changes of technology, and I'm sure the updates they keep getting as well yearly. So, but it's really great. It's a great thing you guys are doing, and we really appreciate your time and the presentation you gave us. I'm just going to open the floor for any more questions, and if not, I think we could just call it there.
I'm just going to really quickly add on to what Steven said. Even if for someone, whatever reason, you don't want to really call or email us, even our Hawaii ship has a very easy ask us anything kind of questionnaire, and it'll
Mhm.
send that question right to our system, and we'll get in contact with you just like that.
Oh, perfect. Okay.
Thank you for your wonderful presentation. This is extremely helpful, and thank you for volunteering and all of service to us. I have a question. I have a lot of people here who are foster home operators, so their members, their clients are on Medicaid. Could you explain a little bit about HIDE and FIDE and plan alignment so they can better understand what is HIDE and FIDE? Thank you.
I don't think I'm qualified to answer that question. I I've heard the terms, but I honestly can't say that I know all of the ins and outs of related to them. That sounds like a Medicaid question to me.
I will say I've also
Yeah,
heard the terms, and
right.
one of our more like the people above me, they've talked about a lot, but we need like an entire other presentation to accurately explain
Right.
all of that, even like the D-SNPs or the alignment is like D-SNPs, the best I can give you like in this quick question is that, like that's when your Medicare and Medicaid can align with each other. But and like there's also some big changes happening there too. So like I'm really sorry, but like that's a huge question and we'd need like a lot more time to truly answer that completely.
Sure, sure. We understand. Thank you.
Thank you.
Okay, we can cover the evaluation. Thank you so much. So for our attendees, especially our foster home or care home operators, please ensure that you complete the evaluation. Again, you're going to complete one per member per resident. So you start with the resident that was with you the longest, and then if you have three residents, please complete 3 evaluations. And there are 3 questions here. The first one, it asks about advanced healthcare directive or living will. So do they have one? It's either yes or no. And the number 2 is does resident have a pulse on file? Yes or no. And then for those of you who are not familiar with POST, it's that dark green form that it's supposed to be in the patient's chart, residence chart, or on the refrigerator, so that when the ambulance is called, they know where to look for that copy. So please answer yes or no. And then the last one is, does resident have healthcare power of attorney or healthcare proxy? So please answer yes or no. Do we have any question about this evaluation or these questions? If not, again, please ensure that we have your correct names and email addresses. In order for you to receive your certificate of attendance, please complete the evaluation, not as a group, but per individual attending it, even though you attended the meeting in a group setting. And for those that are requiring CEUs for the license, folks, please complete the evaluation in order for you to obtain that certificate. Thank you so much, and thank you for all that you do and for being here today. It was a great presentation. Thank you so much.
Thank you.
Thank you so much. Have a great day.
Have a great day.
Aloha.
Thank you.